Good evening, viewers, and welcome to One Exclusive. Namibia, like many SADC countries, has a high HIV prevalence. In 2015, over 200,000 people were living with HIV/AIDS. Amongst others, one key strategy put in place to counter the growing epidemic and bring new HIV infections to zero is voluntary medical male circumcision. The program was initiated following compelling scientific evidence that male circumcision reduces the risk of heterosexual acquired HIV infection for life in men by approximately 60%. The goal is to circumcise over 300,000 men by the end of 2017, which will be 80% of the men aged 10 to 49 years. The national prevalence of circumcised men is slightly just over 30%. Now in the studio to talk to us about this topic is the special advisor for the program, Anna-Marie Nitschke. Anna-Marie Nitschke, welcome to the program.
Good afternoon, Joseph.
We understand that the program is nowhere near its target of having 300,000 men circumcised. Why is that the case?
You know, Joseph, when the country in the national program accepted voluntary medical male circumcision as one of the strategies to prevent HIV, it was towards the end of our national strategic framework. So it means that we needed to first budget for it, make sure that there's enough funding in the next year's plan, and also to get the infrastructure in place. With infrastructure, I mean is to make sure that the hospitals and the facilities where we wanted to do this circumcision is ready for it, and that the staff are trained, both the doctors and the nurses are also trained to perform. But I can tell you with confidence today that we have actually increased the number of men circumcised over the years. Like, for example, last year in 2016, we have circumcised more than 32,000 men compared to the previous year where we've only reached 17,000.
17,000 men this year?
No, the previous year, 2015-16, we have circumcised 32,000. They're the complete numbers I can send to your office. But then in 2014-15, we have only managed to circumcise 17,000, which means that the program is now, you know, rightfully on par with our targets.
Now, what has been your approach in bridging the gap since the number is so low?
Like I said, first we had to get the infrastructure in place by training all the staff, the doctors and the nurses. Thereafter, we also have done an extensive social mobilization. We had one of the Namibian artists, the dog, as our ambassador for the voluntary medical male circumcision, and he has done a lot of social mobilization in those regions that we wanted to target, where we were hoping to get most of the men. So he is also being circumcised in this period. So we do robust social mobilization.
The campaign with the dog, how was it received by the public?
According to the reports and what we have seen, because many of those events have been recorded, it was quite happy. You know, they were really good receival especially from the youth side. They were very happy, and that is why actually we've also chosen him, because we know that he's famous and we know that the youth like his music, and it has really helped a lot. And we've also focused a lot on the school children, making sure that the boys are also circumcised during these campaigns.
So what you're saying is that it yielded the results you expected?
It definitely yielded the results that we expected.
Your team must have encountered social and cultural myths as the ministry rolled out voluntary male circumcision in all four corners of the country. Can you tell us a bit about those myths?
Yes, definitely there were some myths as we go along, and we have tried to overcome it. For example, one of the myths was that circumcision can only be done during winter time. And that is why one of the events where the dog also appeared was during summer, and actually he was circumcised during the summer to prove to the public out there that circumcision can be done at any season. Doesn't matter which time of the year it is, it can be done any time of the year. So that was one. The other one is also cultural beliefs, but we are just trying with our social mobilization to explain to people what is a myth and what is the true facts about circumcision. And I can say that we have succeeded in getting even those who did not believe before in circumcision to be circumcised, and we actually focused a lot on those communities.
Looking at the myth you just mentioned, has there been a noticeable lower turnout in winter as a result of the myth?
Yes, in the previous year, in the 2014-15, you could see that there's definitely, during the summertime, the men didn't come forth, but there was also generally a problem with getting men to the facilities for the circumcision to be performed. So we have just generalized social mobilization and inviting them throughout the year to come, and we could really see that the figures were picking up.
We hear that there are traditional doctors and healers, especially in rural areas, that are performing male circumcision. Is your ministry aware of that?
Yes, we know that there are some, because it was a traditional practice before, we have engaged into it as one of the strategies for prevention, and we know the cultural practice still continues. What we are advising them is that when they do these procedures as part of the cultural, what do you call it? Sorry. Okay. When they do it as a cultural activity, we just encourage them to be hygienic, to do it hygienically, to make sure that they perform it under the most appropriate hygienic conditions.
Is that now when it comes to aftercare?
At the procedure itself, and then also aftercare, because we normally also invite clients to come back 2 days after the procedure for follow-up so that we can see if the person is fine.
Besides myths, how would you respond to criticism out there against male circumcision?
It is, critique will always be there, and I'm sure there's a number of strategies and activities that we are doing for prevention of HIV that is not well accepted in the communities. And that is why we are not alone in this whole fight. We have also the Ministry of Information and Communication Technology on board to assist us in making sure that there's a lot of social mobilization in the communities. We are using posters, we are using the radio station, the print and electronic media to make sure that we give the correct messages to the communities for them to understand. And we always provide room for people to contact the office if there's anything that they don't understand. But we are not negative about the critique out there because we know that we are fighting for the right thing.
Privately owned health facilities out there, how are they coming on board in this initiative?
Privately owned facilities, we also encourage them because obviously there are some people who prefer to go to the private practitioner, to their own doctor. But we also have a linkage with them through AIDS-Free, which is an organization that is currently supported through the USA and the PEPFAR funding. And they also have trained doctors. You know, the training that we do it combinedly. So the doctors that is working, they are also trained in the same procedures and also the aftercare. And they also provide us with statistics. So there are a number of private facilities who are actually registered as forming part of the response. And they regularly give us feedback in terms of how many cases they have done. So monthly statistics are being submitted to the office.
One study that was done has shown that men that get circumcised, it reduces pleasure when it comes to intercourse. What do you have to say about that?
You know, there are different methods that the circumcision can be done, medical, procedurally. And we have not received, in writing any complaints about the methods. And we perceive that it is a myth for now. So we're also inviting the public that if there's anything or any side effects post-op, which means after the operation or after the procedure was performed, to record it to the ministry for us to take proper action. For now, it has been proven that if the procedure has been performed correctly, there should not be any. As a matter, some woman which we have interviewed, if you could see the clips that we have made through MICT, has indicated that it's even better after the circumcision. So for us to really change the procedure of the method that we've been using more commonly, it calls for an entire study, a population-based study to make sure that, and then also the study will be based on what individuals tells us.
You speak of women, but what about the men? Does male circumcision affect pleasure for them?
Yeah, that is a tricky one, and like I said, for us to change from this, we will definitely lead in scientific proof that the men who are circumcised definitely have less sexual pleasure than the woman, or than before the procedure was performed. But right now we don't have those statistics, and definitely we will not change the method, but continue until such time that we see that it's important for us to do a study and find out what exactly. But I can tell you, I think it's myths. People doesn't want to go for it, and then they come up with all sorts of stories.
Is the ministry optimistic that it's going to reach its target by the year 2025?
The 300,000 that has been put as a target was also based on, we are using a population modeling process, which means that they've taken the entire population and used modeling to come up with a target. I'm sure that now that we have developed the new strategic framework for the next 5 years, which is aligned to the NDP5, definitely we will have more accurate targets that we will be able to reach. But for now, the NSF, the National Strategic Framework that ended March 2017, we were not able to reach those targets. As a matter of fact, we were way beyond the 80% target that we have set for ourselves.
So what are you doing to re-strategize in this?
We have rolled out to more facilities, because initially we started with only few facilities and few regions. So we have rolled out to more regions, because we have trained now more staff, both the doctors and nurses, and then on top of that we have the private sector on board, and then we also have the NMICT and all the social mobilization activities, which we hope that can reach more people.
Is this the training of nurses that we see taking place currently all over the country? The training of more nurses?
There's more nurses trained, but we also do on-the-job training or in-service training for nurses and doctors, specifically on male circumcision, on the procedure and then the care they have.
Can you tell us about stakeholders and how they are involved in this initiative?
As a ministry and as a national program, we have what we call the multi-sectoral response in country, which means that when we have activities, it's a combined effort from the civil society, from the private sector, and from the public sector. And we also have financial and technical support through the PEPFAR, the Americans, USA. And what we are doing combinedly is that we plan combinedly. So in the National Strategic Framework, we already look at the targets, and we agreed as to which entity is going to take which portion of the activities to be done. So the civil society is also focusing a lot on social mobilization, whereas the ministry, the public sector, and then the private sector provide then the facilities, the infrastructure, where these procedures are performed. So definitely it is a combined effort and not the ministry alone. And we hope that in future we can even increase the stakeholders to come on board, because currently, like I said, we only have few private facilities who are registered to assist in performing male circumcision, but we know that we have a number of private hospitals in the country. So our next step is to engage those private hospitals also to embark on medical male circumcision as a prevention strategy. It has been done all these years, but it was never done as a prevention strategy. It was only done on request if a person wanted to be done, or maybe if there was any medical indication. But for now, as a strategy, we really want to get also the private hospitals on board.
The current stakeholders that are supporting the initiative, you are saying that you need more support, especially from the private sector and so on. Has it not been significant enough?
When we started, we also selected only few regions. We have never rolled out the program throughout the country. We started with 5 regions, and then we added another 4 regions, and I think there's still some 2 regions who are not even yet on board. So it is a process of rolling out and making sure that we provide these services throughout the country, and then definitely we hope that we can also then increase the numbers.
And which regions are this?
The regions that we started with was Oshana region, Omosati, Kavango region, Zambezi region, Omoheke. I think we started with those 5 regions first. And then we included later Rongo region, Omoheke, Komas, and I think we went up to hardap. But hardap was also not only partially included. So for the next phase that we will start in January 2018 is to include hardap and karas. Then hopefully we've covered all the regions.
In which of...
But they still do, even, it's not that that they don't do circumcision, but not at the level that we expect them to do as a prevention strategy.
In which of these regions were more men circumcised?
I will have to send you those statistics. But I believe that in Omaheke we have quite a high number of turnout because traditionally it was accepted as a cultural practice amongst the population in Omaheke. So it was easier to convince them to come to the facilities and get this done.
For many out there that are still in doubt, what are the main benefits of getting circumcised?
You know, I would really encourage men to go to the nearest health facility and report and request for this medical male circumcision because it really reduces your chances to contract HIV as a man, and it also assists the woman because there's some benefits for the woman to, it reduces the chances of getting cervical cancer. So for men, it's not only HIV that prevents, but any other sexually transmitted infections that they might be prone to. Definitely after circumcision, they have less chances to get those sexually transmitted infections.
With HIV and AIDS, by 60%, is it?
Yes, by 60%.
Right.
But there's really definitely some benefits of prevention from infection.
Nitschke, what about when it comes to homosexual men?
You know, in our national strategic framework, we also have a specific portion where we looked at key populations. So when we talk about key populations, they are ranked, you know, truck drivers, homosexuals, and a number of others. And our strategies does not discriminate against anyone. So it means that any person, even the homosexuals, are encouraged to come for medical male circumcision to be done. Obviously, the sexual orientation is different because they don't have sex with women, but it is still to their own advantage to be circumcised for hygienic conditions, and like I said, also to decrease the lacerations during sexual intercourse.
Are you also publicly encouraging this group to come on board as well?
Yes, no, definitely. We have some specific programs for them. We did actually a study 2-3 years back just to see what is the magnitude of the problem in country and to find ways also to get them on board because it's definitely not easy. But to make also sure that we don't ignore them and that they are part of the response.
What about the procedure itself? Can you tell us about the procedure?
I'm not a medical doctor, no. No, I think in terms of the procedure, like I said, the facilities are being prepared. So this procedure can be done under local anesthesia. You don't need to have general anesthesia, which means you don't need to go into and sleep when the procedure is done. It can be done under local anesthesia, and many of the doctors actually perform it just at their own surgery rooms. I think the principle here is just to ensure that the facility where this procedure is performed is hygienically clean. We call it aseptic procedure to make sure that there's no room for any infection before or during the procedure, and making sure that when the person comes back then to the same facility, it is actually better to give the person the option to choose where it should be done. But if there are cases of general anesthesia, in most cases there is a medical indication therefore.
So it is done in quite a safe environment?
It is done in quite a safe environment. And we also make sure that all the equipment and all the that has been used are sterilized after each and every procedure. So there's no single equipment that has been used twice before it's sterilized.
Looking at traditional circumcision, what is the difference between traditional circumcision and the practice that you carry out?
When you perform a procedure at the health facility, it is being done by a professional either a doctor that's been trained to do so, or in some very few instances also nurses that we have trained to perform the procedure, which means that, like I say, the area has to be surgically clean. So traditionally, we all know that it was done maybe at any place in the village, and we don't believe that they have actually followed any surgically clean or hygienic procedures. Not that we have heard that there's a high number of infections, but we're encouraging them to come for training so that we could just train the traditional leaders also on hygienic clean conditions to ensure that there's no infection after this has been done. But from a medical perspective is that we, medical professionals, has been trained to do a surgical clean procedure in a clean environment and not at home. I mean, otherwise we could have done any other procedure at home.
Is there any discomfort afterwards and the recovery period? How long does it take?
Normally, all the clients that has been, this procedure has been performed are requested to come back to the facility within 2 days. So within 2 days, the person come back, and then the wound, they open the bandage. So it means that he remains with the bandage for these 2 days, and it should not be removed at home. It is only being removed at the health facility, and then the medical, either the doctor or the nurse, are looking at the wound to see whether the sutures are still intact, whether there's any swelling or any other, complications. It has to be taken up already on the second day. 2 days after, if there's nothing wrong, the person is being sent home, and normally the sutures are removed after 5 days. But then we don't expect any further discomfort. The pain and discomfort is mostly within 2 days after the operation.
And for how long should the person abstain from sex?
We encourage them and also to remain at least for 1 month after the operation, not to engage into sexual intercourse. But you also know it depends from person to person. Many persons might adhere to that and stay for 6 weeks, but others might just after a week feel that everything is fine and then they are ready to go.
Any age restrictions?
The age of consent is for medical male circumcision is we start at 10 years. We do the procedure for children as young as 10 years, and then there's the age of consent, which means indefinitely a parent has to give consent for a child between 10 and 17 years. So after 17 years, the boys can give consent on their own, but before they definitely the parent. But we don't also have a cut-off age. 65, we can still circumcise if a person feel that they want circumcision, because you don't know whether the person is still sexually active or not.
And finally, what message do you have for the general public?
Any final message from my side is to say that voluntary medical male circumcision has indeed been approved in the country as one of the strategies for prevention. And we say that there's a 60% chance for a man to prevent them from infected by HIV, but also to invite all the men there out, because we definitely have targets that we want to reach, but we cannot reach them if we don't have the men. So whenever we have campaigns and events that we organize to get the men on board, we really would call on their participation and their willingness to be part of this whole campaign and making sure that we reach the targets that we have set.
Okay, Nitske.
Thank you
Very much for joining me.
Thank you.
And that is all we have for you this evening. Be sure to share your views on the topic with us on our social media pages or by SMSing them to the number 555. SMS costs $1 Namibian. One exclusive. We'll be back next week. So from me, Joseph Sheefeni, goodbye.